Hello everyone, I am Dr. Vijayanand J, Neonatologist and Pediatrician at Rainbow Children's Hospital. We are going to discuss about birth defects. What are they? Why do they happen? Can we prevent them? If they do happen, how can we take care of these babies and children with birth defects? So, birth defects are the defects which are obviously, as explained, are present at birth. So, there are variety of birth defects which can happen. The birth defect can be outside the body, which are very obvious, or it could be inside the body within the brain or eye or in the mouth, like cleft lip, cleft palate, or jaw might have not formed properly, or it could be in the lungs or in the heart. They can have a heart disease, a hole or a block within the heart. Similarly, it could be in the tummy, in the intestines or stomach, and also in the any part of your legs and hands and so on. So, which are obvious outside are called external birth defect. Those who are inside, which are not obvious, are called internal birth defects. And how common, how frequent these birth defects are? The birth defects are not uncommon. Approximately 1 to 3 babies in 100 live births can have a birth defect, and it is variable again depending upon what birth defect we are talking about. The incidence changes and varies. So why do they happen? The expectation when the baby is born, baby should be perfect from head to toe, have all the organs in the well formed in the right way, but unfortunately at times it doesn't happen. There are variety of reasons why these birth defects happen. What are they? So one of them is genetic conditions or chromosomal conditions. The other thing is the lifestyle of mother could be a reason. For example, smoking, alcohol or recreational drugs can also cause. And if the mother has an infection while she is carrying the baby, some of the infections, mother might not even know that she had an infection, but the same infection can impact the baby as the organs are developed, which is in the first 12 weeks of pregnancy, can also cause a birth defect. And some of the birth defects, we don't know why they happen. So a good number of them, we might not be able to find the reason why they happen. So how bad they could be? Well, are these birth defects always serious? No, not necessarily. But if you detect them antenatally, some of them can provide the treatment in appropriate time, sometimes immediately after birth or few weeks after birth or few months after birth. If you effectively treat them, these babies can have near normal life. But some of them can be very serious, very lethal. And those are the birth defects which should be prevented happening. So how do we prevent these birth defects? Well, so first thing, the mother taking care of herself with the lifestyle changes and no alcohol, no smoking, healthy diet and no recreational drugs, and also preventing infections while the mother is carrying the baby. And there is one little medicine called, it's actually not a medicine, it's a vitamin, folic acid. If the mother takes folic acid when the planning before, not after the conception, before, few weeks before the planning the pregnancy, then you can prevent the defects in the brain and the spinal cord. And especially if there is a family history of having birth defects, it is highly and strongly recommended. First thing, you take care for them not to happen. The second thing is, if at all they happen, you detect them on the time. Some of them you can detect even before, very early on in the pregnancy. So even 2, 3, 4 months of pregnancy. If you know that there is a serious birth defect, and the law does allow in India to terminate the pregnancy up to 24 weeks of pregnancy. So the going for antenatal checkup, that means visiting the doctor while the mother is conceived and getting the scan checked, what we call is the antenatal scan, TIFA scan, where they look for a different birth defects, and if it is a serious one, then could terminate the pregnancy. If it is not the serious one, something which has a definite treatment and being delivered at center where those defects can be treated appropriately, because some of these defects may need treatment immediately after birth. Some of the critical heart conditions may need a treatment within a week of life. So, A, you prevent them even before happening. B, you detect them very early on pregnancy so that you can terminate those pregnancies. C, if there are some of the critical but the good outcome with the right treatment, and they should be going to the appropriate health care so that they can be treated. And some of the birth defects are minor, they are very much treatable. One of the things we hear from the parents, and that even the slightest abnormality when detected during the scans of pregnancy, they get very worried, they become anxious, they say, can we terminate this pregnancy, can we not to have this pregnancy? So, but it is the responsibility of the doctor to explain to them these defects are the very much treatable, and it is unethical to terminate such pregnancy. Yes, if the birth defect is a serious one which can impact the life of the baby once born, or may not, the survival chances is very minimal, then of course termination can be offered. And the parents and the families who has birth defects can have a difficult time at the time of birth, even after, but they need to be supported in the society from their own family members, but there are also healthcare professionals, pediatricians and their obstetricians, and direct them in the right way to so that they get the right treatment. We can improve the outcomes for these babies. Finally, I want to say, the moment if you hear a word or term about birth defect, don't panic. First of all, speak to your doctor, find out what it is, and go to the right healthcare service to get the right information and make the right plan for your baby who is not born, or maybe baby who is born having the defect. Thank you.